Guys, I miss you all. Today we're going to start by the last chapter in immunology, that's chapter 8, which is about the disorders of the immune system. Now we have studied chapters 6 and 7. In those chapters we studied about the cells, the elements, the organs of the immune system, and in chapter 7 we studied about the non-specific immune response, which is the first line of defense against intruders. This response induces the specific immune response, which can be either a specific cell-mediated immune response where the effectors are the T cells, or it can be the specific humoral immune response where the effectors are the B lymphocytes. So let's start by chapter 8 on your official book, page 164. Many diseases, broadly referred to as immunopathologies, are associated with situations where the immune system doesn't function properly. In some cases, a deficiency in any of its components, referred to as immunodeficiency, exposes the individual to a greater risk of infection. In other cases, the immune system is itself a cause of disease, as in the case of autoimmune diseases اللي رح ناخد عنهم document 3, which is the last document in this chapter. Let's start first by document 1, page 164. This document is about immunodeficiencies. Those immunodeficiencies can be either congenital or acquired immunodeficiencies. The congenital immunodeficiencies are usually due to recessive genetic defects. They are rare and diverse. And they can be due to an abnormality in the complement system or a phagocyte or a B lymphocyte, and this makes the body more susceptible to infections and to diseases. And also the congenital immunodeficiencies can be due to T cell abnormality, which is much more serious. لأنه as we studied before, the T4 cells or the T lymphocytes, those lymphocytes that acquire the CD4 receptors on their membrane, they are called the head of orchestra. They secrete chemicals that are called interleukins, which activate the cloning of B cells and T cytotoxic or T killer cells. So because of that, patients or infants that are born with a T cell abnormalities, they are unable to mount neither specific cellular immune response nor specific humoral immune response. Now, the last point is that those infants that are born with congenital immunodeficiencies, they are usually placed in a sterilized environment to protect them from infections. Now, what about the acquired immunodeficiencies? Congenital immunodeficiencies, they exist since birth, whereas the acquired immunodeficiencies, they are acquired during the life time. Several causes are at the origin of acquired immunodeficiencies. For example, cancer. As you know, patients having cancer, they are subjected to chemotherapy or to radiotherapy, and those therapies, for example, the exposure to UV rays will kill the stem cells, those cells that differentiate to give us the red and the white blood cells or the immune cells. So due to such treatments, those patients having cancer, they will have a low count of white blood cells. This makes them immunodeficient. Malnutrition may be at the origin of acquired immunodeficiencies. Immunosuppressive treatments that are taken by patients that are subjected to graft, for example, or transplant, for example, kidney transplant. And the most important or the most alarming factor which is at the origin of acquired immunodeficiency is the HIV virus or the human immunodeficiency virus that leads to the acquired immunodeficiency syndrome. So let's start by HIV infection. We're going to talk first about the HIV structure. As you can see in the image, and also the structure is represented on your book, page 165 in document B. As you can see, this virus contains the genome, which is an RNA. It also contains a reverse transcriptase enzyme that makes reverse transcription from RNA to DNA. Around the genome, there is a protective shell of protein that is called a capsid, and this capsid is surrounded by an envelope with spikes. HIV virus is a retrovirus. It transcribes its RNA into DNA using the reverse transcriptase enzyme, and this virus may remain dormant in the cell, or it may replicate or multiplicate inside a host cell. Now, how does the multiplication of HIV virus take place? This figure is very important and it's not found in your book. All the notes are going to be sent by email. You have to memorize the steps and to understand them. They are very important. Now, what about HIV virus? As you can see, the steps are enumerated. They are numbered from 1 till 8. The first step include the binding of certain epitopes that are called GP120 واللي هن that are colored by orange واللي هن they are called spikes. They bind to certain molecules اللي هن CD4. Those molecules exist on the T4 or the T helper lymphocytes. Then this allows the fusion of the virus. So here is step number 1 and 2. Then in step number 3, the virus inserts its RNA into the cell. So it's step number 3, where it is transcribed, where the RNA is transcribed into DNA by the help of the enzyme that is called reverse transcriptase. And this step is step number 4. Then, due to reverse transcription, the viral RNA become viral DNA. Now this viral DNA enters through the nuclear membrane pores into the host cell genome. So the viral DNA is integrated in the host cell DNA. So the process now of this step, number 5, it will end by a host cell having in its nucleus, as you can see, the cellular DNA or the host cell DNA that's colored by blue and the integrated viral DNA. Now the cell have the recipe or have the DNA اللي هي recipe to produce its own proteins and the viral proteins all HIV proteins. By protein synthesis or by transcription and translation, the viral proteins are produced. They are integrated together to produce new virus particles that bud at the surface of the cell and infect new cells. So here is step number 8. So the virus uses the host cell machinery اللي هن organelles that are important for protein synthesis in order to multiply and infect our body cells. Now, what about the phases of AIDS? We're going now to talk about the changes in the concentration of HIV, anti-HIV antibodies and T4 cells or T helper cells in the blood of an infected individual as a function of time. So if we have an individual who's infected by HIV, this curve is also represented in your book, page 165 in document D. So let's start by the initial point, اللي هو time 0. Initially, this patient is infected. So he's infected by HIV. During the first 3 weeks, as you can see, there is no production of HIV antibodies. Okay? But the virus is multiplying quickly. So as you can see in the curve, the amount of the viral reaches a peak or a maximum level اللي هو 10 power 6 per milliliter, copies per milliliter. So the virus is, there is an infection, but there is no production of anti-HIV antibodies. Because of that, the patient is called seronegative. So if he do a serological test but يطلع seronegative لأنه his body now is not yet producing the anti-HIV antibodies. Now after the 3rd week, antibodies are produced, and here is the first phase, which is called the asymptomatic phase. In this phase, as you can see, the number of T4 lymphocytes start decreasing. So only patient is losing his or her immunity لأنه the number of T4 lymphocytes is decreasing and those cells they activate or the cell mediated and the humoral immune responses. Now in the second phase, which is called the slight immunodeficiency phase, in this phase, which is the second phase, the patient shows little symptoms. Symptoms they didn't appear in phase 1, in the asymptomatic phase. So in phase 2, which is a slight immunodeficiency, the patient shows little symptoms and he or she will be in opportunistic infections. So the patient is subjected to invasion to any benign organism due to the destruction of a big number of T helper cells. While the third phase, which is AIDS, in this phase the viruses increase sharply, as you can see, whereas the T helper and the antibodies, they are importantly decreasing. So as you can see in the third phase, the number of T4 lymphocyte is decreasing in addition to the, so it's decreasing. Now, a severe immunodeficiency or AIDS is attained when the number of T4 cells become very low, when it becomes less than 200 cells per milliliter of blood. And this makes the person more susceptible to opportunistic infections that are normally benign. So ممكن أي فيروس ما يسبب disease لأي individual. ممكن patient having a severe immunodeficiency أو having AIDS, it may cause his or her death. So those infections, those repetitive infections may lead to the death of the individual. So here are the phases and the notes about each phase. So as we have said about the progression of HIV, after the infection, the HIV multiplies, its amount increases in the body. It starts infecting T4 cells that drop. This phase is seronegative. The body starts to fight the virus and produce anti-HIV antibodies that neutralize and eliminate the virus from the plasma, but it persists inside the infected cell. This is the seropositive asymptomatic phase. The decrease of T4 cells leads to a state of slight immunodeficiency where the body encounters repeated infections, and a severe immunodeficiency AIDS is attained when the number of T4 cells become very low, which is less than 200 cells per milliliter of blood. You have to memorize this number. The person now is infected by opportunistic infections that are normally benign, and these infections lead to the death of the individual. As you can see in the figure, before the infection we have only CD4 cells or T4 cells أو T helper cells. After an acute HIV infection هون صار في عنا HIV virus particles and CD4 cells, وبدنا ننتبه إنه the count of CD4 cells is lower than with the progression of HIV. The count of CD4 cells is decreasing. So this infection will end by AIDS or by acquired immunodeficiency syndrome, where the HIV particles, their amount is very high in the blood, and the count of T4 cells is very low. Now, the most common methods of transmission of HIV are: first, the unprotected sex with an infected partner. أكيد one of the two partners, if one of the two partners have the virus, and due to sexual intercourse, the virus will be transmitted to the second partner. Also by sharing needles with infected person. Because of that, intravenous drug use transmit HIV. is a had a patient is a drug abuser who is using needles وعنده HIV, وحدا تاني he used the same needle, so HIV is going to be transmitted. بدنا ننتبه للنيدلز اللي بيعملوا فيهم for example tattoo، هو ممكن يكونوا a way of one of the methods that will allow the transmission of HIV. HIV is also transmitted across placenta from an infected mother to the fetus, and أكيد from blood products. Now, what about the possible therapy of AIDS? There is currently no definite cure for HIV infection. So these are the important notes about the first document. You have to read the questions in probing the activity, and you have to answer all the questions to discuss them later. And thank you. I'm going also to send you an extra exercise which is going to be solved later.